Well, good evening, everyone, and thanks for joining us. I'm Sharice Gibson.
And I'm Katie Moore. The number of people getting COVID continues to rise in New Orleans, so city health officials want to make sure that we take steps to get the spread under control. Meg Ferris is joining us now live with a breakdown of what the city is recommending tonight. Meg?
That's right, Katie, and it's been wonderful to enjoy this freedom away from COVID and go back to weddings and graduations and festivals and parties, and also welcome all the visitors that come to the city to enjoy our culture. But as you mentioned, there is a trend upward. The wastewater is telling the story. There's an upward trend in coronavirus circulating in the New Orleans area, and it's circulating among residents and visitors.
In Orleans Parish, as of yesterday, our average daily case count is 155, and that's about a 5 times increase from a month ago. We're seeing that rise in wastewater in both our hospitality district and residential areas around the city.
Hospitalizations are still low, and so are people on ventilators. That's because of our actions.
It always gives me a lot of pride to say that New Orleans is the most highly vaccinated city in the state, and in all age categories, we lead the national average.
But the City Health Department wants to take steps now to keep it that way.
We're not surprised at a summer surge. This is the 3rd year in a row, but none of us want to have the surge we did last year with Delta.
So here's the city's game plan. No mandates, just recommendations. Test yourself. Test right after you or around someone with it, and then 4 to 5 days later when it's more likely to show up on a test. Next, mask as a precaution in large indoor gatherings. Now, get a vaccine, or if you haven't gotten one since last fall, get a booster. Will it keep you from catching the virus? No, but it's proven to shorten the time you're sick, make you less infectious to others, and decrease the chance of getting very sick and dying. And now, the antiviral pill you can take at home is available.
Was shown to reduce the risk of hospitalization and severe outcomes up to 90% in unvaccinated people. That is a huge, huge benefit when you give it within the first 5 days of symptoms.
This current Omicron subvariant is really making people feel sick for 4 to 5 days. And even when you get better, you may have some long-term health problems.
The virus isn't going away, and we've got to anticipate future surges. But they can be ripples and not tsunamis. And that's what we're trying to do today, is make this a ripple and not a tidal wave.
And Meg is back with us live here. Meg, how do you get the COVID medication to take at home?
Okay, so Sharice, it's called Paxlovid. It's made by Pfizer. It is a pill that you take just like Tamiflu for the flu, and it takes a prescription, your doctor calling it into a pharmacy. Now, what if you don't have a doctor, or what if it's the weekend or overnight and you can't get in touch with your doctor? There are some clinics that the city is working with called Test to Treat clinics, and you can go and get both your test and Paxlovid to take home. Now, there's one at the CVS, and that's on Claiborne and Napoleon, and the other are the DePaul Health Clinics. Reporting live from our rooftop, Meg Ferris, Eyewitness News. Back to you.
All right, another important piece of that COVID puzzle. Thanks, Meg. Now, cases are going up all around the state. Almost 900 were reported just in the last day, and that's definitely high compared to what we were seeing this time last month. Thankfully, though, the number of COVID patients in the hospital has not gone up since yesterday.